Breast cancer is one of the most common cancers in women, but the good news is that early detection can make a huge difference. The simplest way to protect yourself is by doing a monthly self-breast examination. No one knows your body better than you, and you'll be the first to notice a change. Along with your regular doctor checkups, these self-exams give you the power to spot warning signs early. So, what should you look for? Start by standing in front of a mirror and simply observing. Do your breasts look the same as before, or has something changed? Pay close attention to the skin dimpling, redness, or areas being pulled inward can all be warning signals. Next, check the nipples. Has the shape or position changed? Do you notice any fluid or discharge? Even small stains on your clothes at night? These are important changes you shouldn't ignore. When you feel your breasts, cover the entire area and notice if there are any new lumps or firm bumps that weren't there before. Even a small hard spot can be significant and should be checked by a doctor. Don't forget to check under your arms too. Breast tissue extends into the armpit, and sometimes cancer shows up there first as a lump or swelling. Remember, finding something unusual doesn't always mean cancer, but it does mean you should see your doctor right away. Making monthly self-exams a habit, along with regular professional screenings, is one of the strongest steps you can take to protect your health. Stay aware, stay consistent, and encourage the women around you to do the same. Awareness saves lives, and the first step begins with you.